Good morning, everybody. My name is the Reverend Shannon Fleck. I'm the Executive Director of the Oklahoma Conference of Churches, and we're glad to have you with us this morning as we reach out to you as Oklahomans and people of faith here in our state. Joining me today, we have different clergy leaders from the state as well as a medical professional to address all of us, and we're going to get right to it. So allow me to introduce first Dr. Noel R. Williams. He is the director of the Greater Oklahoma City COVID-19 Task Force. Dr. Williams.
Oh, thank you, Reverend, for inviting me this morning, and I'll try to make my messaging very, very clear for everyone. I'm the director of a group of chief medical officers from all the main hospital systems in central Oklahoma, including Mercy, Integris, St. Anthony's, OU, Norman Regional, Midwest City, and then we also have Lawton, Comanche County involved. So we've been meeting for the last 9 months on COVID-related issues, interhospital communications, and trying to make things work. We've actually now partnered pretty directly with the governor's office to try to get things done. So the COVID update really is fairly terrifying right now. Our state is averaging 3,000 cases a day, roughly. It's 2,900 to be more exact, but 3,000 cases a day. That we are on a total uptick. And as we were talking before that we actually started, Tulsa's full, their ICUs are full, the hospitals are full. Oklahoma is in the same spot. They're right now, I'll use the example of Comanche County Hospital. They are so overwhelmed that they're on a 4-to-1 patient to LPN ratio in the ICU. There isn't even enough RNs to man the ICU now. They're at a complete and total breaking point. And so when we start to think about what's ahead, we're at the very, very tip of a precipice or at a cliff, and we're about to fall off. And when we fall off, there is going to cause literally hundreds, if not thousands, of Oklahomans to die. And there'll be thousands and thousands more who have significant long-term medical illnesses from COVID-19. And so we've been doing everything we can to coordinate hospital care, patient care. And right now we're looking, just for an example, on the elective surgery. And these surgeries are not elective. It just means they're not emergencies. So if you, let's say, have a really, really bad cancer, that surgery is on the chopping block now for not getting operated on. So we're this weekend having an emergency meeting. Again, it's like every meeting's an emergency meeting anymore, just right now to come up with a plan for all elective surgeries in the state of Oklahoma to coordinate with the governor's office for next week. And it just illustrates that no matter what we do at this point, unless there's a change in the case numbers and the surge of patients, we're in big trouble. And I don't want to say we're doomed, because I'm not an alarmist and I don't like using that kind of language, but in some respects we're doomed. It's a dire, terrible situation. And so what we're asking everyone for is help. And the number one thing for us is, whether you believe it or not, masks do help. The data shows they help. They give you a 2/3 reduction in hospital admissions in the counties that have masks versus counties that don't. If you look at Tulsa, they're getting crushed from the northeastern part of the state and all the people who are getting infected there, because those are counties where they don't wear masks. It is the same thing in Oklahoma City. And we're seeing a 2-to-1 ratio of people from non-mask communities versus mask communities in the hospital and in the intensive care. So we have to cut the caseload. So we need to, again, we're science driven. This isn't political for us. Just like if we recommended, antibiotics for strep throat, it's the same thing. It's not political. We really want you wearing masks. We really, really, really want you to socially distance. We really want to limit your contacts. And in the environment of churches, this is we have to be very careful, because we want people of faith to continue to share that together. But the question now becomes that we need everyone to think about what's the safest way for that. I mean, we want people to meet. I don't want to be any. We don't want to interrupt anyone's religious services. But by the same token, we want you to be smart and think: is there the possibility of doing virtual? I mean, we would really like everyone to consider that. Obviously, we would never encourage any mandates for anything of those natures. We're Oklahomans too. We're independent, but we want people to think about virtual ministry activities, wearing masks if you go to church or you go to the synagogue or you go to the temple, or the mosque. We need people to stop the spread of the virus. So that's a lot of talking. So thank you.
No, thank you. And thank you for putting that in accessible language. What I hear you saying is that we are at a crisis point in Oklahoma.
We are at an
Is that
absolute
correct?
crisis point. I mean, I can't understand. I'm just not. It's hard for me not to even get to some of this language because I'm so focused on always being calm about everything with medicine. But no, it's a disaster. I mean, we're about to get crushed. And the thing that people don't understand too, it's not just COVID patients who are going to be affected. If you have a heart attack, where are they going to put you? I had a gentleman in, because I'm a gynecologist, but we do all kinds of other internal medicine stuff, who was in liver failure 2 days ago. I sent him to the heart hospital. It was the only place I could get him into for even getting an assessment. He was there 2 hours and they sent him home. I mean, he would be admitted for a week or two normally, but they're like, nope, there's nothing we can do. Go home. Good luck. And that's what's happening now. And so, no, all our care is going to be affected. You can't. We're basically a point. You can't get sick enough to need a hospital anymore. There's not going to be the staff. There's not going to be the accessibility. But then when this is over 3 months from now, if we stay like we are, there will not be a healthcare system left in Oklahoma. I mean, that's what people don't understand. It's going to destroy the healthcare system in terms of the infrastructure and the staffing. And, there's several institutions, which I won't give their names, but they've had huge dips in the number of patients they can even take care of because so many of the staff went out with COVID. And so again, we want a functional healthcare system long term to take care of all of us. But we also have to get through COVID first in order to have that. And just to highlight Tulsa County had 370 cases yesterday. We had almost 800 in Oklahoma City, but that only counts for about 1,100 of the 3,000 cases. So the other 2,000 cases are from all the small counties, and some of the counties in the northwest part of the state have the highest. Well, there's one county, Alfalfa County, that is in the top 10 in the United States. Overall, we're in the top, I understood yesterday, we're in the top 2 or 3 in North America as a hot spot as a state, and one of the top 10 in the world. So again, we have to do something to stop the spread.
Thank you. I appreciate you coming and joining us and being here, Dr. Williams. I appreciate it. Thank you.
One final comment. The reason we wanted to come to you, and there's different members of our group communicating with all different faith organizations this week, because we believe that Oklahomans care, and Oklahomans are a very awesome group of people, but they're also very faith-based. And so if the messaging can come from their faith leaders about considering wearing masks and being careful and not going to Bedlam and things like that, that would be really outstandingly helpful.
Thank you.
Oh, thank you.
Thank you. Next, I'm going to ask Aaliyah Shimmy to join. She is the Executive Director of the Tulsa Metropolitan Ministries. Aaliyah?
Good morning, Shannon. Thank you so very much for putting this together for us. We really, really, truly appreciate it. In Tulsa, as in the rest of the state, we have watched the numbers go up and up as we hear nothing but pleas for personal responsibility from our leaders. In my Islamic faith tradition, it teaches us to love for our brothers, sisters, and our neighbors what we love for ourselves. So in caring for the safety and well-being of myself as a cancer patient by wearing a mask, I am also in turn caring for the safety and well-being of all those around me. While we do have freedom in this nation, freedom doesn't mean anything without responsibility. We each must take seriously the impact of our decisions on other people, especially right now. We have to make adjustments. We have to sacrifice for the common good. We have to learn to do precisely what our faith traditions command us to do, and that is to love our neighbors. I stand in support of this statement because it lays out clear objectives that were not generated by us, but by the medical experts like Dr. Williams and scientists who have been working so hard, and we cannot thank you all enough, Dr. Williams, so hard on this. We here in Tulsa, as you heard, our hospital beds are at capacity. Our medical staffs are exhausted and stretched to their limits. Our bed space is beyond capacity. Our mayor and other civic leaders have been asserting that this is not just because Tulsans aren't all doing what they should be doing, though that is true. It is also because people around Tulsa, the ones who depend on Tulsa's services for their lives, are also not doing what they should be doing. We are grateful that a few surrounding cities have passed mask ordinances and begin to take serious measures and join with other civic leaders in asking for more action. While the CDC does list safe practices for houses of worship doing in-person services, it is also incumbent upon us as faith leaders to lead by example, to do our best to enforce those guidelines if we are worshiping in person, and to be a model of self-sacrifice and compassion. While the statements represented reflects the high ideal in terms of mitigating behavior, and not everyone will be able to comply with those recommendations, we all should, at the very minimum, be asking our in-person attendees to wear masks, self-distance, practice good hygiene, and provide necessary environment and supplies for that to happen. We have to help people get past this idea that their personal choice bypasses the need for public safety in this pandemic. So as one of the faith leaders here in Oklahoma, I implore you, please, 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 please practice your safe distancing. Please be safe. Thank you.
Thank you, Aaliyah. Next, I'm going to ask the Rabbi Abby Jacobson, who is the president of the Interfaith Alliance of Oklahoma, to join us to speak.
Thank you very much, Reverend, and thank you, Doctor, and thank you, Director, for everything that all of you do. On behalf of the Interfaith Alliance representing Oklahoma City and its surrounding areas, we are so fortunate to have so many different faith groups represented around our table. And we are so fortunate to be able to learn from one another. And the things we have learned from one another, all of our religions basically ask the same things. Be loving. View your body as either a gift from the divine or a vehicle for personal betterment. And put yourself second and the needs of others first. We are expected in this time to seek comfort wherever we can. And for people of faith, we know that that is your religious community. But our religious communities have never just been about a building. In my time, just my time on earth, I have prayed in a bomb shelter. I have seen faithful people praying outdoors, in beaches, in fields, on cobblestones, going from a single wide trailer to a storefront in a strip mall to a gigantic building. And now, thanks to the blessings of technology, you can go to church on TV. You can attend worship services of all sorts of faiths online. And we are asking that you make use of those resources, that you make use of the resources that God has given us to reach people who should not be endangered. We are asking you to do the deeply faithful thing of putting yourself second and putting the needs of the vulnerable first. We're not commanding you, we're begging you. Please. This is not about forcing you. This is about imploring you. Will you help us? Will you help your clergy make good, healthy decisions? And if you are a faith leader or a clergy person, will you be able to continue to summon the strength so that when your parishioners come to you and say, I'm angry about the masks and I'm angry about the distancing because I love my neighbors and want to be in their lives, will you be able to summon the strength to say, I know you're in pain and I will support you through it, without giving in to the pressure to pretend that everything's normal? It's not. And they are turning to us as faith leaders to support people through something unprecedented in our lifetimes. And it's taking unprecedented strength from faith leaders to make those good decisions and to be servant leaders who are humbly and faithfully serving a community by providing good leadership. If you are a member of a faith group, please support your faith leaders and clergy in making those good decisions. And if seeing another human being in a mask makes you angry or sad or scared because it reminds you that things are not normal like you want them to be, please reach out to your faith leaders and your friends and your neighbors over the phone, over the computer, or from a safe distance away, and tell them you're hurting, and tell them you're angry, and tell them you're sad. Don't abuse them for choosing to wear a mask. Don't abuse them for choosing to close an institution that's important to you. Tell them, it hurts me. Tell them I'm scared. Tell them I'm angry. Share those feelings because you need support and you need love. And please, when you think about loving your neighbor, remember that you have the strength and power to love your neighbor in the smallest of ways by keeping them safe, and know that it will have lasting, beautiful consequences on the strength of your community if we can just get ourselves the support we need to provide this kind of leadership. Thank you.
Thank you, Abby. Thank you so much. In closing, I want to say that the Oklahoma Conference of Churches prepared a statement that has been referenced here. You can find that statement on our website. We will post the link across this video. But I would like to say something to the Christian community who's watching. In our scriptures, Jesus is depicted as a shepherd. And that depiction is a beautiful one because a shepherd doesn't only lead their flock. A shepherd protects their flock. You know, back when these scriptures were written, there were no gates. There were no, nicely constructed fences to keep sheep in and to keep them safe from robbers and thieves who might come in and steal them. So the shepherds would literally lay their bodies across openings to protect the sheep. So we are asking, if you are a faith leader, lay your body across the gate for your sheep. Make this hard decision. And if you are a person of faith, the miracle you have been praying for is right here in you. It is a miracle that you are breathing. It is a miracle that your heart is beating. It is a miracle that you are alive. You are the miracle that your neighbor needs to make it. So wear the mask, no matter where you are. Worship online if you can. Stay home and stay safe. Lay yourself across the gate and be the miracle that you are. Thank you. Go with blessings. Wear your mask. Stay safe. Blessings.